Come see us live on tour. We'll be in Los Angeles, Dallas, Texas, Austin, Baltimore, Hartford, Syracuse, Atlantic City, Cohoes, New York, and Providence, Rhode Island. Go to jimmydore.com for a link for tickets.
The COVID vaccine, the CDC is now saying that there has been enough cases of people who have had the vaccine, received the vaccine, and then suffered a stroke. The agency will now be investigating any potential links between the shots and the strokes in some of those patients.
Okay, no big deal. We don't know what it is. So Chief Nerd caught this. So the CNBC guy, this guy, so they bring on, he has a lot of questions about why people are being sick now, why is cancer on the rise. And he has a suspicion that it might have something to do with the COVID-19 vaccine, which is crazy. So who does he bring on to ask about this? The former head of the FDA, Scott Gottlieb. And guess where Scott Gottlieb works now? He's on the board of Pfizer. Of course. Again, this is the exact thing RFK Jr. is trying to fight against, and that's why they have to call him crazy and cuckoo. And CNBC, they bring on the guy right from Pfizer, who used to be the head of the FDA. And by the way, when the newspapers talk about Scott Gottlieb, when the news organization, they refer to him as former FDA director. They don't go, guy who just went from the FDA directly to millions of dollars at the Pfizer board.
They don't say current Pfizer spokesman. They don't say that.
They don't say current Pfizer. They say former FDA head. It's amazing. But anyway, so he's going to ask him. So watch this.
On a serious note, I tweeted this out. A friend of mine, and if you're watching, I love you, diagnosed stage 3 breast cancer.
And so I just want to let you know.
On a serious note, I tweeted.
So the difference between what this guy does and what I do is his set. That's the difference. He has this big, beautiful set, and I don't. I have a tiny little room in my house. Okay, here we go.
Also, he gets great interviews with the great
Gottlieb. He gets the great Scott. He gets the great Scott Gottlieb on.
Gottlieb.
This out. A friend of mine, and if you're watching, I love you, diagnosed stage 3 breast cancer yesterday. Okay. Close family members of mine have had it. Another buddy of mine just had a stroke. He's nonverbal now. Buddy of mine was in a hospital for 3 days, just got out yesterday or 2 days ago, RSV pneumonia. I know I'm getting older. I know we're all getting older. Is it just me or is everybody sick? Like the level of RSV, pneumonia, all this stuff going around, strokes, breast cancer. New York Times did a story on breast cancer spiking. Doctor, can you give us an answer as to why? Because you know where I'm going with this. A lot of people point to COVID and maybe even the COVID vaccine because it.
Maybe even
the COVID vaccine. Well, I think you have your tinfoil hat on a little too tight because. No, there's nothing different from before. Little kids have always just grabbed their chest with a heart attack in classrooms. That's all. We were just tougher. We were just tougher back then, Kurt, and we didn't talk about it. That's all.
Well, climate change.
And it was probably
yeah.
Here we go.
Oh no. What is it?
Yeah, look, we don't know is the answer.
We don't know.
We don't know.
We don't know.
Ideas? Can we speculate?
So Scott Gottlieb, corrupt criminal, who used to be a corrupt criminal heading the FDA, is now a corrupt criminal at Pfizer. And he's on CNBC. Why? Because Pfizer gives truckloads of money to CNBC so he can come on and bullshit people. And the truckloads of money are there so they don't bring on someone like me or Dr. Robert Malone or Dr. Pierre Corey to go and to debunk him. So that's why there's no one there to push back on him when he says, we don't know. Let's just watch this again. This is beautiful.
On a serious note, I tweeted this out. A friend of mine, and if you're watching, I love you, diagnosed stage 3 breast cancer yesterday. Okay. Close family members of mine have had it. Another buddy of mine just had a stroke. He's nonverbal now. Buddy of mine was in a hospital for 3 days, just got out yesterday or 2 days ago, RSV pneumonia. I know I'm getting older. I know we're all getting older. Is it just me or is everybody sick? Like the level of RSV, pneumonia, all this stuff going around, strokes, breast cancer. New York Times did a story on breast cancer spiking. Doctor, can you give us an answer as to why? Because you know where I'm going with this. A lot of people point to COVID and maybe even the COVID vaccine.
Maybe even.
They don't know. What is it?
Yeah, look, we don't know is
We
the
don't
answer.
know.
Some cancers are going up. You're right. Colon cancer in particular, the incidence has been going up, particularly
Especially
in young
under
people.
30. Yep.
Right. So we don't understand that. Some people believe it's related to changes in the U.S. diet.
Oh, some people, like what? The people who make vaccines think that? Some people.
As far as the infectious disease that's going around, we have had a difficult season with flu, with COVID, with RSV. Those rates look like they're coming down across most of the.
See, look how they refer to him. They don't go Scott Gottlieb, corporate whore, working for Pfizer spokesman. They refer to him as a CNBC contributor. So part of his, I guess he must get a check from CNBC. Why? Because that money comes right from Pfizer.
Oh, does he pay CNBC to make him to pretend he's a good doctor?
I guess so.
He's contributing.
Dr. Scott Gottlieb, when was the last time you treated a patient? That'd be my first question.
Yeah, well, Dr. Jill Biden, when was the last time she treated a patient?
Here we go.
Country right now, with the exception of norovirus, which is still going up. The strain of norovirus that's circulating right now is a new strain, so a lot of people probably don't have baseline immunity to it, and that's why you've seen so many people getting it and so many people getting sick. That's about the incidence of norovirus.
Whatever you think, it's definitely not because the boosters create wreck your immune system and make you more susceptible to catching viruses. That's not what it is. Just if that's what you're thinking, that's definitely not. Even though the Cleveland Clinic did a study that showed the more boosters you took, the more likely you were to contract the virus, the more likely you were to get sick. That's been buried. We don't talk about that anymore. That's not real. And it's definitely not the fact that the two people who were in charge, the 30-year-long employees of the FDA in charge of the vaccine department at the FDA resigned over the booster program. It's definite. And then they got replaced by who? A couple of schlubs like him, a couple of corrupt liars like him. They got rid of the. So if you're anybody who stands up and says something like, "Hey, I don't think the boosters are good, and this is bad," you resign. They just replace you with a tool, a willing tool. So that's what happened there. But it's definitely not because of the boosters. It's definitely not because they wreck your immune system, like Dr. Robert Malone said they had a good chance of doing on our show in the 2021 when no one else was pushing back against the COVID narrative. He said just because one vaccine is good doesn't mean two is better and three is best. They could wreak havoc on your. They could have deleterious effects on your immune system. It's definitely not that, though. I'm just letting you know. There's some people out there thinking, is it because the boosters are screwing up people's immune system and making? Remember when Mika told Joe Scarborough that, wait, after you got your booster, you got COVID, you were sick for months. Remember that? It's got nothing to do with that. That's all just anecdotal evidence. That if you piled it up, it would reach the moon. But that's just, and it doesn't matter.
I hope Scarborough kept taking boosters. I hope he did.
He did. I hope me too.
Coronavirus right now is probably
healthy.
2x what it was in the last 5 years in prior seasons. So there is more of that going around right now.
Let me ask you a difficult question. Did we hurt ourselves in some ways by avoiding stuff for so long that now these super bugs have been created? Otherwise, I'm just not sure what.
Those super bugs are created in a lab in Wuhan.
Yeah.
Lots of them also in Ukraine. I don't know. That's why the pardons go back to 2014. That's when we overthrew the government of Ukraine. And then Joe Biden got appointed a head of Ukraine policy for the United States. And that's when Hunter Biden got his job, his no-show job on the energy board. That's when Joe Biden made sure that the government had to fire the investigator investigating Burisma, where Hunter Biden worked. All that stuff.
Remember then Hunter took his dick to an Asian wet market, so to speak?
So this guy, who I appreciate he at least asked the question. I like his Pat Sajak haircut.
Yeah.
The guy, and I'm jealous that, his hair dye looks fantastic. I'm jealous of guys who are brunettes. Anyway.
Really?
Yes. Anyway, he at least he brings it up. But of course, he works for a corrupt organization that's corrupted by big pharma money, and he's asking a guy who's on the board of big pharma, Pfizer, and they pretend he's not because they say he's a CNBC. They call him doctor, and he's a contributor. Then they go, oh, he's the guy from the vaccine maker. They don't say that.
I wonder who his loved one is that he's asking these tepid, not quite probing questions that quickly are not go nowhere. On behalf of, and then he tries to find another. Is it because we locked down and that created the super bugs, or could it be that we're actually my whole family's dead? Do you think there's a connection? There's not.
Could it be that we're actually creating super bugs in laboratories all around the world right now? Could that be it, or is it that we locked down? I bet it's that we locked down. He doesn't even bring up the fact that we're literally creating. The former head of the CDC said that the only way this bird flu is going to be able to jump is if they do gain of function research on it. Remember we played that video of him saying that?
Yeah.
And they're doing that research right now.
You can't go by what they said.
And by the way, I hate that they call it research. It's not research. They're doing science fuckery.
Yeah,
that's not research. Nobody wants
doing is crimes.
Nobody wants anybody doing gain of function research. Barack Obama stopped it, and then Fauci went around him. Nobody wants it. So kudos to this guy.
I'm sure Obama was cool with it, though.
Yeah,
I'm sure it's not like Obama was like, "Hey, did you keep doing it?"
Going on.
Yeah, well, with the flu season, RSV, and COVID this year, the levels of infection weren't out of proportion to what we've seen from the historical norm going back maybe 10 years. There was a rebound after COVID because people were sequestered and a lot of these pathogens didn't circulate. I think we've worked through that and we're getting back to more of a...
Yeah, remember how flu just disappeared during COVID? Remember that?
Yeah, and then it existed again.
And then it existed again.
COVID's.
The flu lockdown. Isn't that funny?
It transitioned again. It changed its identity to flu again.
Anna Benani says Gottlieb was FDA commissioner until April 2019. He left to join the board of directors at Pfizer. Pfizer expects to make $100 billion this year. Borla made $24.3 million last year. Pfizer will lose $20 billion in patents by 2026. Vaccines as service equals illness as product. That's what Anna Bani says. Anna Biani.
Borla only made $24 million? That seems like he must get...
Well, that's, I think, plus I'm sure he has stock. And the Biden administration dished out $590 million hours before he left office. And where did it go? It went to Moderna. $590 million. You know what he gave the fire victim? $700. Moderna secures $500 million funding from U.S. government for bird flu jab, who the former FDA director said they were doing gain of function to make it be able to jump to humans.
Oh, by the way, couldn't get eggs at...
It's like you create a problem and then you sell the solution. Isn't that interesting? And you get funded to do both of them.
Yeah.
You get American taxpayer funds to do both of them.
Jimmy, there was no eggs at the store yesterday at the supermarket over here.
Really?
Which has to be some shortage because the bird flu, bird flu shit. It's a great racket, man, because you have all aspects. You can just corner people into going where you want.
Here is Pfizer board member Scott Gottlieb says he has a deep concern about RFK Jr. leading HHS.
Really? I hope he does.
Donald Trump has made all of his picks for the health-related team, and joining us right now to talk about all of this and what it means to the sector is Dr. Scott Gottlieb. Of course, he is the former FDA commissioner.
The guy looks like a Goomba from the fucking mafia.
He does. He does.
I'm in the import-export business, Mr. Senator.
I hope this pricks deep concern. Yeah.
My respect. I have impeccable respect in my own country.
His reputation is impeccable in his own country.
Impeccable. My reputation is impeccable.
He's just here to see his brother. He only speaks Italian.
There are buffers. 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 I sell olive oil. I'm a retired businessman living on a pension. I don't know why you're coming at me like this.
I have deep concern. I hope the deep concerns make his dick not work.
under the last Trump administration. He's also a CNBC contributor. And Scott, you're still a board member at Pfizer as well?
That's right.
Okay, and a board member at Pfizer. Let's jump into this.
I like how she kind of says that at the end under her breath. And you're still a board member at Pfizer, right? Correct? Okay, you're still a member. All right, whatever.
That's the closest thing to having scruples I've seen on this channel ever.
At least she mentioned it.
Yeah.
Yeah, like she goes, okay, I got to mention it, but it's not important.
Yeah, it's like, but you
let's just dwell on it for a minute, not go by that part.
The most important thing you've ever, the biggest money grab you've ever had in your life, you're still doing that? Okay, just want to make sure the biggest money grab you ever did in your life.
The thing that gives you a reason to lie right now in this thing we're talking about, you still work for them, right?
You still work for them?
Who wouldn't tell you if there was a problem.
Okay.
Why don't we start with the incoming administration's choices? Because there's been a lot of consternation, a lot of people who have said, wait a second, with RFK Jr. heading things up. What do you say?
Why don't they have a guy right from Pfizer headed up? Oh, you know, like you. How you were the head of the FDA? Shouldn't we have someone like you headed up? The RFK's never worked for Pfizer. Isn't that weird?
How would he be qualified?
How would he know what to do if he hasn't worked for Pfizer?
As somebody who served in the last Trump administration.
Yeah, look, well, I have deep concerns about Kennedy's stated intentions to roll back core public health protections, particularly as it relates to childhood vaccines. He's brought in a very experienced team, a lot of lawyers from the Children's Defense Fund, which is his anti-vax organization. These guys.
You don't want to roll back children vaccines. Bastards. You don't want to roll back children vaccines. You know how the first vaccine kids get is the hepatitis B vaccine? You know how you get hepatitis B? You get it from intravenous drug use or unsafe sex. Why would you give that? Why would that be the first one they give to a baby?
There's not any good answers to that.
When I tell that to people at Hollywood parties, they're like, what? That's crazy. I know. That's why. But they're never told that by criminals like this. That guy, unbelievable. Looked like he just walked out of Goodfellas, this guy.
Well, I like that I'm supposed to hate the Children's Defense League.
Yeah.
A team of lawyers.
Yeah.
He's like, because he brought in these experts from the Children's Defense League, like, boo! Children's Defense.
They're capable. I think they're deadly serious. They've been very clear about their intentions. And I think sometimes you have to take people at their word. I'm not so sure that people really understand how Kennedy's intentions are going to translate into policy and how serious he is. There was an article recently where one of his
there was an article recently that we funded, by the way, over at Pfizer. You know, anyway, we paid for this article to be written recently.
Confidants, Del Bigtree, who's going to be probably brought into HHS, said, you know, he didn't get inside the castle to forego his long-held beliefs. They're going to follow through on these.
Are you urging Republican senators to not confirm him?
Look, I think that there's skepticism in the Republican caucus, more than I think the press is reporting right now. There's going to be ag state senators that are concerned about his impact on food prices. There's going to be principled pro-lifers who are concerned about his positions on abortion. And there's going to be a number of public health-minded senators.
So that's the new thing now.
What did he just say?
That's the new thing now. So now they're pretending. So now they're trying to get right-wingers to oppose RFK Jr.
Principled pro-lifers.
Because he's not against abortion. That's what they're doing.
This is really unbelievable. They actually put a little principle because pro-lifer is automatically bad in the world of
automatically
shitlings.
Bad.
So now there's a new Pokemon called a principled
pro-lifer.
And that means you're against abortion, but you're for 72 vaccinations for kids at birth.
who have deep concerns about his position on vaccines.
If you were talking to a Republican senator, would you say that the appointment of RFK could cost lives in this country?
Could cost lives.
I think if RFK follows through on his intentions, and I believe he will, and I believe he can, it will cost lives in this country. I think some in Congress right now who are deeply skeptical think that they can manage this through things like appropriations riders. That's not going to be successful because, like I said, RFK can go in there with a stroke of a pen, disband ACIP, reconstitute it with like-minded people, issue a whole new bunch of recommendations. He can frustrate the ability to take the money from the Vaccine for Children's Fund.
He could get them to take, like stuff like aluminum out of vaccines. Come on, we need aluminum in vaccines.
Hey, take people at their word, he said. The Children's Defense Fund is coming, and I should take them at their word that they're defending children, is what you just said to me.
Yeah.
You didn't tell me why it's bad. Like, I'm supposed to already think they're bad.
Yes.
Okay, like, I know the Patriot Act is bad, but it's because someone told me why. When I first heard of it, it sounded good. So you got to tell me why this is like the Patriot Act and not be about being a patriot. You know, he hasn't done that. I'm supposed to know.
Which would impede a state's abilities to vaccinate children. There's a lot of things that they could do day one, very easily, administratively, and I don't think there's a thing Congress can do.
I hope he's right.
A key component of the corporate capture of public health institutions that Kennedy also vows to slam shut is the revolving door. So he wants to end stuff. So this guy is completely corrupt, and he went right from the FDA to the people he was supposedly regulating. That's called regulatory capture, meaning that he actually works for the people he's supposed to be regulating on behalf of people. So that guy's just what he looks like is he looks like a mafia criminal, because that's what he is. He's a mafia criminal, and the mafia is Big Pharma, and he's their foot soldier. He's everybody in the Uniparty. He's the boss of his own family. He's got his own family. Yeah.
The news, all of that Uniparty, the Republicans who are concerned that you might not shoot kids full of aluminum and shit, that's all the same mafia, like the 5 families.
That's right.
They all get joined together.
How is someone supposed to monitor the quality of a corporation unless they are also on the payroll of that corporation?
Yeah.
We're just not thinking.
You get what you pay for, you know? So that's why you want me to do good jobs. You got to pay them.
That's right. Come see us live on tour. We'll be in Los Angeles, Dallas, Texas, Austin, Baltimore, Hartford, Syracuse, Atlantic City, Cohoes, New York, and Providence, Rhode Island. Go to jimmydore.com for a link for tickets.